Hello and welcome back. In this lesson, we will be diving into one of the most important topics in health heart disease. As the leading cause of death worldwide, understanding heart disease is crucial for everyone. Whether you are a healthcare student, a concerned individual, or just curious, this video will guide you through everything you need to know about heart disease in a clear and expert manner. Heart disease is not a single condition, but a group of diseases that affect the heart and blood vessels. It is often used interchangeably with cardiovascular disease, but cardiovascular disease also includes issues with the blood vessels of the brain and body. Heart disease specifically refers to the conditions that directly impact the heart structure and function, including problems with the coronary arteries, heart muscle, valves, and rhythm. There are several types of heart disease. First one is the coronary artery disease, which is the most common and involves the narrowing or blockage of the coronary arteries. Heart failure, where the heart cannot pump blood effectively. Arrhythmias, such as atrial fibrillation, which are irregular heartbeats that can lead to stroke. Congenital heart defects, present from birth, which may affect the heart walls, valves, or blood vessels. Cardiomyopathy, a disease of the heart muscle that affects its ability to pump blood. Heart valves diseases, such as stenosis or regurgitation, that affects the flow of blood through the heart. Pericarditis or inflammation of the heart's lining, often caused by infections or autoimmune conditions. Rheumatic heart disease, a complication of rheumatic fever that can damage heart valves. According to the World Health Organization, heart disease remains the number one cause of death globally, responsible for an estimated 17.9 million deaths each year. That's about one third of all global death. The burden is especially heavy in low and middle income countries, where access to healthcare is limited. Economically, the treatment and consequences of heart disease cost billions of dollars annually, affecting individuals, families, and national healthcare systems. Heart disease develops from a combination of risk factors. These can be modifiable or non modifiable. Modifiable risk factors include high blood pressure, which is also called hypertension, high levels of low density lipoprotein cholesterol, smoking tobacco products, diabetes mellitus, obesity and overweight, lack of regular physical activity, unhealthy diet, particularly one high in saturated fat, salt, and sugar, and excessive alcohol intake. Non modifiable risk factors include age, particularly people over 45 years for men and 55 years for women, family history of heart disease, biological sex with men at higher risk earlier in life, ethnicity with South Asians, African Americans, and certain other populations are at higher risk. At the core of most heart disease is a process called atherosclerosis. This is a condition where fatty deposits or plaques build up in the walls of arteries. Over time, these plaques narrow the arteries, restricting blood flow to the heart. If a plaque ruptures, it can form a clot that blocks blood flow entirely, leading to a heart attack. Chronic inflammation play a key role in the progression of atherosclerosis. In the heart failure, the weakened heart struggles to meet the body's needs, triggering fluid retention and organ damage. Symptoms can vary depending on the type of heart disease, but some common signs include chest pain or discomfort, also known as angina, shortness of breath during exertion or even at rest, fatigue and general weakness, swelling in the legs, ankles, feet, or abdomen due to fluid retention, irregular heartbeats or palpitations, dizziness, lightheadedness, or fainting spells. In advanced cases, symptoms may include confusion or difficulty concentrating, especially in older adults. Some people, especially those with diabetes, may experience silent symptoms without obvious warning signs, making regular checkups essential. If left untreated, heart disease can lead to severe complications such as myocardial infarction or heart attack, stroke, especially if clots travel to the brain, chronic heart failure, arrhythmias like ventricular fibrillation, sudden cardiac arrest, renal dysfunction, or peripheral artery disease, which restrict blood flow to the limbs. These complications can be life threatening and often require urgent medical intervention, rehabilitation, or long term care. Diagnosing heart disease involves a combination of tools and tests. Doctors usually start with a physical exam and patient history, then may order blood tests to check for markers like cholesterol, blood sugar, and troponin, electrocardiogram or ECG to detect electrical activity and rhythm abnormalities, echocardiogram for imaging the heart structure and function using ultrasound, stress testing to evaluate the heart under exertion conditions, often using a treadmill or medication. Coronary angiography for visualizing arteries through dye and X-ray, cardiac CT or MRI for high-resolution imaging and detection of abnormalities. Treatment depends on the type and severity of heart disease. It usually includes lifestyle changes such as dietary improvements and exercise, medications to manage symptoms and reduce risk, interventional procedures or surgeries to repair or unblock heart structures. A team approach often involving cardiologists, dietitians, pharmacists, and primary care doctors provides the best outcomes. Continuous monitoring is important to assess treatment success and adjust therapy. Common medications include antiplatelets like aspirin to prevent clot formation, beta blockers to reduce heart workload and control blood pressure, angiotensin converting enzyme inhibitors to relax blood vessels and improve blood flow, statins to lower LDL cholesterol and stabilize plaque, diuretics to manage fluid buildup in heart failure, nitrates to relieve angina by dilating blood vessels, calcium channel blockers to reduce blood pressure and regulate rhythm, anticoagulants for patients with atrial fibrillation or artificial valves. These drugs are typically taken long term and require monitoring for side effects, drug interactions, and kidney or liver function. In severe cases, doctors may recommend procedures such as angioplasty with stent placement to open blocked arteries and restore blood flow, coronary artery bypass grafting surgery, where blood flow is rerouted using vessels from elsewhere in the body, valve repair or replacement surgeries for defective heart valves, pacemaker or implantable cardioverter defibrillator insertion to regulate rhythm. In rare cases, heart transplantation may be necessary for end stage heart failure. Each procedure is selected based on the patient's condition, overall health, and treatment goals. Lifestyle changes are often the first line of treatment. Adopt a heart healthy diet rich in fruits, vegetables, whole grains, and lean proteins. Limit salt, sugar, trans fats, and processed foods. Engage in regular physical activity, at least 150 minutes of moderate intensity exercise per week. Lose excess weight to reduce cardiovascular strain. Quit smoking and avoid second-hand smoke. Limit alcohol consumption to moderate levels. Manage stress through meditation or counseling. These changes greatly reduce the risk of complications and improve quality of life. Preventing heart disease is achievable with proactive measures. Get regular health checkups to monitor blood pressure, cholesterol, and blood sugar. Maintain a healthy weight and active lifestyle. Eat a balanced diet and stay hydrated. Avoid tobacco products completely. Keep alcohol intake within recommended limits. Understand your family history and take early action if you are at risk. Public education and awareness are vital components of prevention strategies. Schools, workplaces, and governments should collaborate to support healthy environments. Heart disease does not affect everyone equally. Women may have atypical symptoms like nausea, back pain, or fatigue, and often delay seeking care. Older adults are more likely to have comorbidities like diabetes or kidney disease, complicating diagnosis. People with diabetes are at double the risk of developing heart disease. Children with congenital heart disease may require lifelong monitoring and multiple interventions. Tailored approaches ensure better detection and outcomes in each group. Talking heart disease requires more than just medical treatment. It needs community involvement, government support, and healthier environments. Policies promoting access to nutritious food, physical activity, and preventive care are essential. heart disease can be largely prevented by modifying everyday behaviors. Education campaigns, school based programs, and accessible healthcare can collectively reduce the burden. To sum up, heart disease is a major global health issue and leading cause of death. It comes in various forms and affects people differently. Understanding risk factors, symptoms, and treatments can save lives. Prevention, early detection, and lifestyle changes are key to reduce its impact. Empower yourself and others with knowledge and healthy habits. That's it for today. Thank you for watching. I will see you in the next lesson.